I like to know things.
So today I want to ask you a question because I really want to know what you think. But before we get started, I kind of have to set the stage a little bit, so bear with me. The FDA is the Food and Drug Administration, and what they're supposed to do is regulate the drug industry. So today what I want to talk to you a little bit more about is advisory committees and what they do. What they do is they have meetings and they advise the FDA on what actions they should take. Okay, so these advisory committees are actually made up of people that aren't employees of the FDA, but are actual doctors or scientists or pharmacists that are employed outside that just give advice to the FDA on what to do. This committee will meet if there's some sort of a problem. For instance, if they need to put a warning on a medication, or if maybe there's wording in the instructions in the medications that need to be changed, or if they need to put a black box warning on it. They meet and advise the FDA on what to do to fix it. Okay, so you might remember a few years ago they added a black box warning to antidepressants stating suicidality because a certain number of people had increased risk of suicidality after taking the drugs. So what they did was they had the advisory committee meet to tell them how to handle it. And another example was whenever they took Vioxx off the market, they had an advisory meeting to discuss how they should handle that. So I did a little digging into the FDA Psychopharmacological Drug Advisory Committee members, and I was looking for any sort of industry ties. And what I found was pretty interesting, so I want to know what you think about it. So the first person I want to talk to you about is James McGow. He was a member of the Psychopharmacological Advisory Committee. Now what that means is he's advising the FDA on whether to put warnings on the drugs, whether to put black box warning on the drugs, or whether to pull a medication off the market. Now at that time, or before that time, he was also a paid consultant for the following companies: Novartis, Shire, Johnson & Johnson, Cephalon, Janssen, McNeil, Lilly. And also was at that time or before that time a paid speaker for McNeil, Lilly, Shire, and Novartis, as well as receiving research money either at this time or before this time from Boston Life Sciences, Shire, Pfizer, Lilly, Cephalon, McNeil, Novartis, Gliatech, and Johnson. So basically, my question to you is, he was advising the FDA on what to do with the drugs, and was either at that time or sometime previous also being paid by the pharmaceutical companies to do different things from 12 different companies. Do you think really that he should be advising the FDA on what to do? Okay, so the next person I want to talk about is Wayne Goodman. He was actually the chairman of the Psychopharmacologic Drug Advisory Committee. And at this time, or before this time, he was a paid consultant for Janssen, Novartis, Pfizer, Elon, GlaxoSmithKline, Solvay, Bristol Myers Squibb Company, and Eli Lilly. And at this time, or before this time, he was also a paid speaker for Pfizer, Solvay, Janssen, GlaxoSmithKline, Bristol Myers Squibb Company, Eli Lilly, and AstraZeneca. And also at this time, or before this time, he was receiving research grants from GlaxoSmithKline, Eli Lilly, Pfizer, Sanofi Aventis, Wyeth, Abbott Laboratories, Forest Laboratories, Janssen, and Solvay. So do you think the chairman of this committee should be advising the FDA on what to do about these drugs when he's receiving all this money from the pharmaceutical companies? So last person I want to talk to you about is Dr. Lewis Morris. He advises the FDA on drug safety and risk management. But he also owns a PR company that helps pharmaceutical companies with risk management and FDA regulation. At the same time, he's advising the FDA on safety issues. Okay, so this doctor's client base reads like the Fortune 500 of pharmaceutical companies. Abbott, AstraZeneca, Bayer, Bristol Myers Squibb, GlaxoSmithKline, McNeil, Merck, Novartis, Pfizer, Procter & Gamble, Johnson & Johnson, Solvay, and Wyeth. So there's my question. Should somebody who's receiving money from the pharmaceutical companies be on a committee advising the FDA how to regulate these drugs? It's almost like an employee at a restaurant telling a health inspector how to do his job. So I really want to know what you think. In my opinion, it's considered conflicts of interest. Please leave a comment and let me know. So there's my video. Hope you like it. Please rate it and subscribe, and I'll see you next time. For hundreds of great more videos like this one, check out the Psyche Truth channel on YouTube.